Why is European public health insurance registration complex for Americans? Imagine moving to a new country and suddenly facing a maze of paperwork, rules, and unfamiliar procedures just to get health coverage. That's often what Americans experience when trying to register for public health insurance in Europe. Unlike the United States, where health insurance is mostly private and tied to your job or individual plans, European countries run their health systems differently. They are funded mainly through social security contributions or taxes, and the rules are strict about who qualifies. One big reason for the complexity is that most European countries requiring you to be legally living and working there. If you are an American planning to move, you need to secure the right visa or residence permit first. This process involves proving your income, employment status, or pension details, which can take time and effort. Each country has its own rules, so what works in France might not be the same in Germany or Spain. Another challenge is that each country manages its own health insurance system. There is no single European-wide registration process. You have to learn and follow the specific steps of your new home. This might mean visiting local social security offices, getting a social security number, and registering with a local health provider or insurance fund. These steps can be confusing, especially if you do not speak the language well or are unfamiliar with local bureaucracy. The paperwork involved can be extensive. You will likely need official documents like proof of residence, employment contracts, passports, and sometimes marriage or birth certificates. These documents often need to be translated into the local language or legalized, which adds more time and expense. Without proper guidance, it's easy to make mistakes or miss deadlines. Americans also have to think about their existing health coverage. Many have private insurance or Medicare, but these are usually not recognized in Europe. The European Health Insurance Card, which provides access to health care in European Union countries, is only available if you are already registered with a European social security system. Until you complete your registration, you cannot use this card. There is also a difference between temporary visitors and permanent residents. Short-term visitors might only need private insurance or limited coverage, while those planning to stay long-term or work in Europe can access full public health benefits. Understanding these distinctions is important for planning your healthcare coverage. If your registration gets delayed or denied, navigating appeals or resolving issues can be complicated. You need to understand local laws and how to communicate with authorities, which can be intimidating for newcomers. To make the process smoother, it helps to research the specific health system of your destination country before moving. Secure your visa or residence permit that allows health insurance registration. Prepare all your documents in advance and consider getting certified translations. Once you arrive, register quickly with local social security or health authorities. It's also wise to seek advice from local expat groups, legal advisors, or relocation specialists familiar with health registration. During the transition, keep private health insurance active until your public coverage is confirmed. Remember, the European Health Insurance Card is only available after you are officially registered in a European social security system. By understanding these differences and steps, Americans can better navigate the complex world of European public health insurance registration and ensure they have access to health care while living abroad.